Hi everyone, welcome back to my channel, JessieLynnsRibbons. Today I have a guest appearance, Cobalt, or just John. Today we're going to be talking about me going to visit my plastic surgeon and what happened, and then what followed after that. So we'll get into that. So we went to go see my plastic surgeon, and he was a really nice guy.
Very polite.
Yeah, very polite. It was just, he knew what I wanted. I wanted to be fully flat. I didn't want any mounds. I didn't want any fake breasts. I didn't want any of that. He knew exactly what was happening. But when I got there,
it was in the referral and everything.
Exactly. And when I got there, he sat me down and he was like, well, before we get to what you want, let me just go, literally, before we get to what you want, let me just go over what
all your options are.
Exactly. And first he started with, I actually have paper what he did. First he started with, fake, you could screenshot if you want to. Okay, that's what he drew, and he wrote, first he went over getting implants or getting expanders first and then implants. So either direct mastectomy, direct to implant, or getting a mastectomy, I always say it wrong, and then you have an expander for like 3 to 6 months, and then you get your implants. And then he had me hold the implants, and I'm like, okay. And then he had me hold the expander and feel everything, and I'm just like, okay. He was like, so what are your thoughts on that? Do you think that that's a good fit for you? And I'm like, I remember looking at John. I'm like, are you? No. I was like, no.
Because we even brought up, there's a higher risk of, breast cancer patients getting a lymphoma.
And he even agreed with that. He was like, that is true. It's not always talked about, but it is true. So it's like,
we don't know why it happens,
yes,
but
he said that.
It does happen.
And then
so we're like, no.
I was like, no. I was like, I'm good. And he's like, okay, let's go to the next one, which is the DIEP. And
deep.
I still don't know what the hell that really is, but they take like something from your stomach and they put it up top. I don't know.
The way that he explained it was, we're going to go into your abdomen, we're going to take out a chunk, and it's going to have, a blood vessel in it, and then we're going to put that where your breast was, connect the vessel, and then, that'll be what
we're going to take out this weird chunk in your stomach right here. That's what he drew. It's going to come out. And then we're going to put it into your boob right here. Like, what? Okay.
Which, if that worked for you,
cool. I mean, that's great, but
that's not what you wanted.
Right, and he didn't explain it very well either. So he was like, well, how do you feel about that one? Because I'm like, no.
That sounds like an even worse idea.
I would rather be flat. But I threw out there, just for the shits and giggles, I was like, what if in the future, after going flat, could I possibly get something done? If I wanted to. Not that I do. I said that. I was like, not that I do, but if I wanted to.
If you would change your mind,
right.
Years down the road.
Because I will be flat, so it will be tight, And he was like, oh, yeah, it's totally possible. And that's when we would do the DIEP. And I'm like, why did I even open my goddamn mouth? Because after I opened my mouth and said that, that's when he was pushing for this, for me to, like, for him to do whatever he was going to do for me. He was pushing to not do as much. That way he had more skin and more everything for later down the line.
I have a lot more that I could work with.
Exactly. And then after that, he finally...
Well, we weren't okay with either of those, obviously. No, so here, let's throw another one into the mix.
Exactly. So then he throws in, which I'm going to flip it now so you can see the next part. This is the back of it. So this is called the Goldilocks.
It's not the official name. That's just what they call it.
So where he'll cut you, where it's a cut on the bottom and then a cut that goes up the nipple. So this right here. So cut. And then they take the flaps and they bring it down and bring it over. So that way it turns into a mound. So this would be me.
So it looks like you have a little bit of something instead of nothing.
Exactly. I don't want that. So after a double mastectomy with no reconstruction, you will look like this. You'll be a little bit like concave. But after time, it will fill in a little bit and you won't look like that. He said that he wanted to do the Goldilocks, which would do this, open up the flaps, and then he'd bring each flap down, which would give me that. Does that look like flat to you? No. So this was my drawing, okay? So you could screenshot if you want to. Okay, concaved, flat. What the fuck did he want? Don't want that. So he mentioned me getting liposuction to get rid of those little, those little chunkies that are under your armpit. And I don't mind that. That's cool. If my insurance covers it, I'm going to get it. But right now, it's not that big of a priority to me. Right now
it's beating cancer.
Right. And making sure my reoccurrence rate is down, fully down. And so he kept going on about this damn Goldilocks. And I'm like, no. I was like, And then he kept pushing it. I'm like, yeah, if we can get me flat with it, then sure. And that's when he drew the mound. And he was like, oh, you'll have a little one. He showed me photos of girls that he actually used Goldilocks and they had breasts from it. Like, no nipples,
like the one that he showed, and he specifically pointed out, well, I did this procedure on her, but she wanted to make sure she had the same size breasts that she had going into it. But we didn't realize this at the moment, but until after the fact, we came home and we were like, he never showed us
anyone flat. He never, not once showed us anyone flat. He even sent me home, which I'll explain what you're about to see in a second. There's an explanation for this, and yeah. He sent me home with this book.
A Woman's Decision.
Okay. And it's about surgical options for autologous.
Yeah,
breast reconstruction. Knowing full well I did not want to have another surgery after this was done, unless it was by, my personal breast surgeons, a little fix here and there.
A minor adjustment.
Way down the line. Okay, after I've been healed, after everything's been, had. And he just, he wasn't getting it. And it wasn't making sense. So we just I was just like, I just wanted to get the hell out of there at that point. And I'm like, okay. And I signed the paper and left it at that. And then we immediately called my breast surgeon.
Well, before that, we got in the car and we were driving home, and both of us are sitting there, we're like,
what the fuck just happened?
What is going on?
The whole point of that was for him to beautify my scar.
It even said in the referral, to make the incision look aesthetically pleasing.
And meaning just to make it look straight.
No puckering.
Nothing. And that's all I wanted. And because she's going to be going straight across all the way to as far back as she can.
We know you guys can't see your hands.
Right. But. It's as far back as she can, and just make it look nice. And he was like, no. We're going to, instead of going all the way back, we'll cut you right here. You can't see my boobs are so fucking low. I breastfed.
So these are boobs.
Okay. And he wanted to, instead of going, so these are boobs and then, the armpit, right? He was like, we'll go right here, and then that's where I'll do the cut. So we're not going to go all the way back. And I'll have your breast surgeon go through your nipple
to do the
mastectomy. And then that way it leaves me all that skin to work with, to bring in. And I'm like, what? I'm a visual person. I need to see things. Though this, that doesn't give me what I need to see. And what's in here is all,
the complete opposite of what you want.
Complete opposite. I would show you, but I would get flagged immediately. And I'm just like, what the hell? And I'm sorry, my GERD's is acting up. I'm stressed out.
Oh, my GERDs.
Yeah, my GERDs. And So again, like John said, we were in the car and we're like, what the hell just happened? Like, I'm confused. It's like the referral said this, like he knew what we were coming into and he still did that. Again, great guy, but what he did wasn't okay. And then on top of that, I'm sorry, but maybe this is just me, but doctors, before they put their hands on you, they put gloves on. Okay?
That's actually standard practice.
No gloves, was grabbing my breast. I have my incision from my lumpectomy. He grabbed right where the incision was and he folded my boob up and he was hurting me. And he just kept grabbing me. And then when he took me to the other room, he wouldn't let John or anyone come with me. And then he was taking my photos and he was like, do you feel safe at home with him? And I'm like, yeah. Why? Like, why wouldn't I? Well, he was just, he's very just, he just very, what was the word?
I wasn't there.
No, the word, very abrasive. He comes at you very, just very hard. And I'm like, that's because he's advocating for me, because he cares, not because he's harming me. And I was like, he's scared. He's nervous because he has to take care of me after this. So like, he wants to make sure that, whatever is going to happen with you is going to be, I'm going to be okay in that. Because he knows with my breast surgeon, I'm going to be okay. But he doesn't know this guy. And he was like, oh, okay, that's fine. And then he comes back into the room with me after he takes the photos and everything. And, he was like, do you have any questions? Not to me, to him, because he was like, I'm here for you. So it's like, you need a hug, I can give you a hug. And I'm like,
I was like, I don't need no damn hug from you.
So that was that.
But either way, we left Dr. Kevorkian's office.
That's not his name, but we're making that up.
Yeah. Well, I mean, it's a real doctor's name, but it wasn't your doctor's name.
Well, I need to drink. Hold on.
And, after we had been successfully confused and discussed it, Jess was like, I want to talk to my breast surgeon. And, on our way home, I called up there. I was like, hey, is there any possibility that, we can talk to her? I know that she had some openings at her other office. Is there a chance while we're, already in the area that we could, swing by? And the nurse was like, I got to call and, find out, and then, I'll let you know.
And sadly, there wasn't an opening. But on her day off, she came to the office, called us on video, made time for us, and she assured us that he was fully in the wrong.
Yep.
He was completely,
her words, and I quote, he just wasn't getting it.
Yeah, like he's like, how do you not? She was like, how do you not get that? Like, she's like, I even get it. It's very clear what you want. I don't understand how he's not getting this. She goes, but if you feel comfortable enough for me to do it, like, is to beautify it the best I possibly can, I will do the best I can for you.
And give you what you want the best that I can.
Without him, because he's obviously not going to get it. And I don't want you to wake up and you have something that you didn't want, which is having a mound. And I'm like, that I want you.
It wasn't even just the mound issue. It was, the amount of drains and placement of drains and all these, everything that he was like, this is the way it's going to be. There's no negotiation about it.
You're getting drained. No negotiation.
Yeah. It's late at night. Don't judge me.
You're getting drains. You're getting antibiotics for 10 days. You're getting this, that, and the other. I was like, what? Excuse me? Because my surgeon's like, you can have 2 drains, you can have them in your sides, you can have them in the front, you don't even have to have drains, you can just come in, I can drain you. Like, she gave me options.
What I loved about, your breast surgeon, in comparison to almost every other doctor we've had, was that it was a discussion.
Right.
It was, we were allowed to have input. We brought up our concerns. We talked about different options.
Exactly.
And she's like, I would personally recommend this, but if you're not okay with that or you can't do that for whatever reason, we can adjust.
Exactly.
And we'll work with you on it. So, I mean, that was really nice to have. And, I commend her for it entirely.
And then she calmed us down, more than me, but she calmed me down, and she went over the whole procedure all over again and what we were going to do differently, so that way it can make up for him, for the plastic surgeon not being a part of this anymore, and that she would call him and everything and just tell him, oh, we just, we wanted to go a different route, so that wasn't like an issue. And she made sure everything like that was okay. So I was finally calm. Like, all right, I'm happy now. We're gonna do it with you. No one else needs to be involved. She asked John, she's like, do you have any questions? Like, I want you to be, you know, confident with this and okay with this. She asked him everything. He answered, and he asked her everything. And then after that, we were calm and we were happy about everything. And we're like, okay, we're 100% doing this. We're ready. And then
we're as ready as we're gonna be.
Yeah, ready as we're gonna be. And then we'll give you a little sneak peek real quick, because I'm trying to make this a little not so long. We went and had our what's it called? Our drain teach. So they teach you about your drains. And so I would have the option of getting drains on either side of my breasts. Well, I won't have breasts.
What won't be?
What won't be there. So drains on either side of me, or drains in the front, or one drain straight across. And my goal is to see if I can get drains at the top, since when you move around, your chest doesn't move
as much.
So, especially without breasts, it doesn't move as much. So it would be less agitation, everything like that. So I'm gonna see if she can do it up top. And I'll update you guys probably. I'm hoping daily to, like, even if I jump on live for a second or I make a video for a second, whatever, so you guys can see the process of it. And I'll even show milking my drains. But yeah, so I decided I'm gonna get 2 drains, and it's gonna be in the front. Whether she will agree to do it up here or she does it down below. But that's what I'm gonna get, because if it's in the front of me, then I know I'm safe and I'm not gonna like pull it or anything's gonna happen. And then
you can still sleep on your sides if you could.
Well, I can't.
No, I'm saying if you could.
If I could sleep on my sides, then yeah, but I won't be able to, because the slices will be going back pretty far. So like I have my bed, sleep number, the head goes up, the feet goes up, and then we brought the reclining chair into the bedroom as well. So that way, if I would try to turn onto my side, which I can't, my ass is going in the reclining chair, so that way I can't move and I'm stuck. So we did that. And as for the drain teach, we learned how to milk the drains, and we learned that they're super like soft, and they're very small. Yeah, they'll irritate me. That is actually the worst part of a mastectomy. It's not the mastectomy itself, it's actually the drains.
Because it's a foreign body. It's
right.
It's something that's not supposed to be there.
Exactly.
In there, and it's gonna feel weird.
Exactly. So they're gonna do that, and we learned about it, and then I will be showing it in videos. So I'll always put a disclaimer in the beginning. That way, if you don't want to see blood or like little material that will come out, like a tissue and stuff.
Clots, all
type of stuff. So that way you guys don't look, because it is actually, YouTube does allow it to be on. So I will show it. It's just, I'll give a warning. That way you can just click the hell out and you don't have to see something like that, because I'm already grossed out and I still have to go through it with John. But we might even have an in-home nurse come in to do it every day. Not all day long, but just come in, check my incision, check my ball, drain, need supplies, whatever. So that is what's gonna happen. And I'll also be staying the night at the hospital, and then I will, if I need to stay longer, I can. So if worst case, up to 3 days. If there's something wrong,
you get an infection or something like that,
then I'll stay longer, so maybe even up to a week. But real quick, I'm gonna explain this as quick as possible. This was the book I showed you. It's missing something right here, and then what the hell? It's missing something right there, and it's kind of dented in certain places. When I got home, before we were able to speak with my
I'm picturing this whole event happening.
I was very emotional. Okay, I've had one breakdown this whole process. Okay, and most people, they've had many breakdowns where they cry. I held it in so freaking tight, and I shouldn't have done that. But I held it in the whole time, and I've had one breakdown, and we got P.F. Chang's one day, and I threw all of our food across the kitchen and busted it, and I was screaming at the food, and I was just like, I hate my life. And like I burst into tears. I ran to the bathroom crying. And then this time,
in your defense for that instance, they did mess up your food.
And they didn't. Yes, they messed up my food too. So I mean,
so that
it was a double whammy.
That was the straw on the camel's back for that instance.
Yeah, and then this time I came home. I was so frustrated, and I wanted to punch something. I had nothing to punch. I didn't want to bust anything in my house. And the only thing I could think of was I was holding this stupid book that was all about getting, reconstruction later on that I didn't want in the first place. So I grabbed the book and I'm like, John's right there. And I'm just like, I don't fucking want this. And I ripped it and I chucked it against the wall. And I'm like, I was done. And I burst into tears and I'm like, just get out to the door. Just don't come back. Just get out. I need time to myself. And he was like, okay, you have all time you need. He left and I'm just screaming. He heard me from the living room. I was screaming and I was crying and I was just so emotional. And that was my second time ever having a breakdown in almost this whole year, and it was just, I think when you're going through something like this, it is okay to let your emotions out the whole time.
It is okay to not be okay.
Yes. And I held it, and I wish, if I could go back, I wish I wouldn't have held all my emotions, because now I'm at that point where I'm at the breaking point, and whenever I have that emotion, I break, and I burst. And so that was my second time ever having a outbreak like that, and it was scary.
Not outbreak, outburst.
Outburst, sorry.
Outbreaks are problems.
I know what that is. And
you had an outbreak.
I had an outburst, and I just couldn't handle it. So from now on, I'm going to start slowly talking about my feelings so it doesn't happen again. But yes, so that was what happened when we went and met with the plastic surgeon that we are not getting.
We shut that down.
We shut it down. That is what happened when we talked with my breast surgeon. She, oh God, I love her, fixed everything for us. That is what happened when we went to our drain teach, when we learned about the drains and all the nastiness that comes along with it. And yeah, so that is what's gonna happen, and we just wanted to let you guys know. And I hope you enjoyed this video, and we tried to make it as short as possible. There's a lot of information. I left out a lot, so did John, but I mean, if you want to know more, we can always go into more detail.
Drop it in the comments. We'll talk about it.
Drop it in the comments. There's way too much. So I'm going to leave it here. And I hope you guys liked it. So I hope everyone has a great day or great night, depending on where you are. And y'all stay blessed. Bye, everybody.
Bye, guys.